welcome to Better Health Together, and I'm joined today by Dr Walid Jammal, who actually practices in Western Sydney, if I'm correct.
That's right.
And Wally is, I'm going to say, a thought leader and, influencer around how general practice and effectively the medical home as a concept can be created and sustained in general practice. And Wally's provided great advice to us over the years around, firstly, the 10 building blocks of a high quality practice, but also now the quintuple aim. So, Wally, if you were to describe a gold standard general practice, what would that look like?
Well, thanks for having me here today, Leon.
Welcome.
Thank you. Look, that's a good question. I think the important thing is to really concentrate on principles rather than describe absolute detail. The principles of a gold standard general practice, in my mind, is one that is equitably accessible, that is coordinated, that is integrated, that has a built-in, structurally embedded, systematic quality improvement strategy, and most of all, one that is patient-centred. Now, that's a very broad, sort of high principle definition, and we often get stuck at, thinking about what patient-centredness is truly about. I personally, in my mind, I thought I was patient-centred for 20 years of my working life, and I didn't realise that I wasn't until I really started asking a very important question from patients, and that is, what matters to you rather than what is the matter to you. And so building care around the needs of the patient by asking thoughtful questions and redesigning systems as much as possible so that it's built around the needs of the patient.
And it seems to me, given the principles that you expressed, general practices using their data, collecting data and then using it is critically important.
Look, I think one of the most important things as professionals working in the provision of healthcare generally, and general practice is obviously a very important part of that. We're professionals, and part of professionalism to me is actually doing good. But actually not just doing good, but doing better. And so if we really truly ask ourselves, how can we know whether we're doing better today than we did yesterday? How can we know if we're doing better tomorrow than we did today? That is the principle of continuous quality improvement. How could you possibly even do that without data? We're in a system that we think we do good because patients keep turning up. But that's not necessarily correct. Of course it is, because the value of the relationship between a GP and their patient is sacrosanct and incredibly productive and incredibly valuable. But we need to build in measurements around everything that we do so that we can ask those questions from our data, and we can ask them quickly and get an easy answer.
So building on that and using your data, and I'm making the assumption you already do, I have to say, how do you know you're making a difference?
Well, I think this is where building a continuous quality improvement framework into everything that we decide to change. Now, we could leave things as they are and never change a thing. The only way of knowing whether we make a difference is to ask patients. But actually, if we're asking, how do we know if we're making an improvement, we need to build, that's where the model for improvement really is a framework that assists us in actually measuring whether we are doing better. I think the most important thing, one of the most important things, is to keep asking patients whether we're making a difference and asking them what matters to them and measuring their outcomes. And when we talk about outcomes-based measurement, we talk about, improving outcomes all the time, but we often forget that actually one of the most important outcomes that we really ignore to measure to make sure that we are making a difference is to ask patients about what they feel about their health and their health outcomes and what is important to them.
No, that is correct. Wally, thank you for visiting us in Perth.
No problem.
Thank you for your contribution to the primary care environment, and thanks for today.
Thank you for having me. Take
Pleasure.
care. Thank you.
Bye for now.
Bye.